the dashboard that the nurse will be seeing when they log in. So to get the flow of what we are doing, you need to look at the previous videos to get a glimpse of what we are doing. So let's continue. So the dashboard, the nurse can see the patient's reports, the triage section, and the patient accommodation. So let's get started by the patient's report. So from the patient's report, they can see the patient, the medication they've been prescribed, and the amount they paid, and all the patient details. They can click on that button and see the patient details and everything about the patient. So let's go to the next section, which is the triage. So when a patient is admitted to the hospital by the receptionist, this is where the system sends them. If they are a normal case, that means they don't have an emergency. So this is a patient that was admitted by the receptionist, so they've been sent to the triage section so that the nurse can have a look at them, and after the nurse looks at them, they'll be sent to the next process, which will be to see the doctor. So let's look at this patient who's been sent here. Now the nurse takes the vital signs, so the blood pressure, so as you can see, if any of these vital signs is out of the normal range, the system detects that and notifies the nurse that this case is out of the ordinary, so it immediately upgrades the patient to the emergency status, so they'll immediately go to see the doctor. So after they enter all the vitals, they can enter the medication the patient is taking. So say paracetamol, and they can make the observations. Or the nurse themselves can administer the injections that they think will help the patient. So they'll toggle and say they look for the medications that can help the patient. So after they administer the medication will be immediately routed to the billing, so that the billing officer can be notified of how much to bill the patient. Also, if a patient visited here before, visited the hospital before, you can be able to see the previous records. So for everything that was administered, the nurse will be able to see from this page, from this button. So after the nurse has finished checking the patient, they'll click complete triage assessment. So this patient will proceed to the doctor. So the next thing we are going to look at the nurses section is the patient accommodation. So there's the ward management and the inpatient care. So from the inpatient care, the nurse can see the patients that have been admitted to the hospital that need help. So when they do their their daily labs, they'll be able to see all the client information, and all the information they need to administer the drugs based on what the doctor had described. So it will be there. So let me show you the ward management. So here the nurse can assign a patient to a ward. They can view wards, they can view inpatients. So let's assign a patient. So this is a patient, John Chege. They've been admitted and by the doctor, and the doctor said they need to stay for checkup. So depending on the ward they can afford, the nurse can approve, can assign them. So if John Chege, a patient, chooses a 4,000 ward, the nurse clicks here and assigns to Chege. If they can't afford that, they can afford for 2,000. The nurse clicks on this tab and then assigns them. So let's assign them to lab ward B. So as you can see, this alert says patient is now an inpatient. So when we look at the inpatients, John Chege will be there and all their information. So let's view the wards. So this is the ward management area. If a new ward has been developed and has not been entered here, the nurse can add the ward here and all the information about the ward, the number of beds and everything. So let's view the inpatient. So from this dashboard, the nurse can see the number of patients and the wards they've been allocated. So John Chege is the one that has been admitted the latest. So they are in ward B, bed 2. So let's see them and all the details. So if a nurse is doing their morning routines, the morning lab, they'll see that in bed number 2 of ward B is John Chege. They can make the observations, recovering. They can administer medications depending on what the doctor had said. So if the doctor had admitted them here and made a diagnosis, so we put here test, but a diagnosis can be anything like malaria or anything. So based on this information, a nurse can know what type of medication to give John Chege, or the doctor can actually diagnose and prescribe medicine, and all this, the records will be right here. So let's say the nurse looks at John and thinks they need paracetamol, so they'll just search here paracetamol, the kind of drug they need to administer, and then record. Also, if the nurse, so the record of the nurse comes here. Now these records are aligned in the order of which they were assigned. So if the nurse who does lunchtime labs comes and looks at the patient and thinks they need radiology, then just select the service. Yeah, so all these records are automatically sent to the billing and to the departments responsible for administering them or for performing them. So for instance, these records, the last ones, this one who needs an x-ray, the department that does the x-ray will get the notification to do the radiology for that specific patient. So when the patient visits them, they'll just look at their dashboard and just ask them the name and know what to do. So yeah, that is the nurses dashboard.